if you've assessed someone for ADHD and they've been diagnosed, how would you? They might ask you, what does it mean to have a diagnosis of ADHD? What would your response be to that question?
I'll just start off even with the name, attention deficit hyperactivity disorder, and it's a list of 18 symptoms, and they're pretty good, um, but it's incomplete. Like ADHD is not really an attention deficit, it's more of an attention allocation problem. So this sort of starts the discussion of the nuance and hopefully geared towards the person's experience. But I'll talk about the attention allocation problem, and some of these are analogies, metaphors used within the field that borrow from others, and hopefully they borrow from me. But that ADHD is more of a performance problem than a knowledge problem. Most people say, I know exactly what I need to do, but I have a hard time doing it or organizing it, or I come up with great plans, but I don't follow them. So these examples, I think, resonate for a lot of people rather than, and these are not wrong, being distracted, being restless, or being impulsive. And very often people will be forthcoming with their stories, either, oh yes, that sounds like me, or other things. So it gets at, in a way, I'm going to borrow a line from, one of my early mentors saying that, there's no cognitive therapy for depression. The cognitive therapy treats the problems of depression, the low energy, the not doing things, the whatever it may be. That's really what we target, and I think cognitive behavioral therapy for adult ADHD is very similar insofar as we're probably not treating the core symptoms, but we're treating the executive functioning difficulties, the time management, the disorganization, the motivational issues. So this sort of explanation with clients, how we make sense of ADHD so that we can understand it and it helps with the evaluation, but also bringing it back, it gives the targets, the real world targets for treatment, that are probably why people have sought us out in the first place. And I just want to make clear that medication treatment, I'm a psychologist. I do not prescribe. I cannot prescribe. But I have great respect for what psychiatry can bring to the table for treating adults with ADHD or anybody with ADHD. And, by targeting the symptoms, that can be very helpful. I like how Steve Ferrone and Kevin Antshell, they differentiated between narrow band treatments and broadband treatments. So medications would be considered a broadband treatment. You treat the symptoms of ADHD, that it has these broad positive effects. Just like getting corrective lenses, eyeglass lenses, can help with reading, but might help with other things like driving, other things. And CBT numbers among the narrowband treatments, very specific targeted treatments like academic accommodations or educational support services. ADHD coaching would fall into that realm, but so does cognitive behavioral therapy, where it's focusing on the day-to-day functioning. Now, just because it's within the narrow band, those can be very broad band treatments, because it's really what we're all about is how we spend ourselves, what we do with ourselves. And, going back to see, you're getting the academic answer to a very straightforward question, but it's, part of, and what is so insidious about ADHD, it's doing the things that, not only the things we have to do as responsible adults, but also the things that we want to do, be it for well-being or self-care. And that's really the focus of a lot of the psychosocial treatments, is overall well-being. But that's insidiously what ADHD gets in the way of.
Yeah, and that last point you mentioned, I think, is really important. Many people who criticize ADHD as a diagnosis would say, don't we all struggle with these things? Don't we all struggle with, doing the things we kind of have to do, the mundane things to get on in life? There's an argument to be made there that, people with ADHD really suffer with doing those mundane things, perhaps to a level that other people simply don't. But then also, I think an even more powerful argument, as you just pointed out, is people with ADHD have a really hard time actualizing their desires, their passions, They, for example, would love to learn the guitar, but they just can't do, doing anything to a high level, enjoyable or
Right.
not, requires a certain amount of tedium and dedication. That might be doing the scales when you're playing guitar or just showing up to practice every day. And I hear that, when I see people with ADHD, it's not just that they can't do their taxes, that there are very real things, their hobbies, or even, spending time with their children, or doing things which require a little bit of patience, which they really struggle with. And often they seek treatment to help with those very things.
Right, including following through with healthcare recommendations, physical therapy, a medication regimen like antibiotic or whatnot. I worked with a client who was diagnosed with Lyme disease, but was very inconsistent in the antibiotic treatment, which extended the illness longer than they wanted to. And you know what, you mentioned something about, don't we all have ADHD? And based on some research, and it's nothing new, but it's a way to answer those critiques to say, well, yeah, in a way, a case could be made that not that everybody has a little ADHD, but the difficulties are not unfamiliar. But the study I used to cite that dimensionality of ADHD, like when we think about it in self-regulation or that executive functioning model, these are standard human factory settings. We all have the executive functions. Uh, the impulse control, that's part of what makes us human, being able to stop and pause and motivate ourselves for things that we don't want to do. So everybody has this capacity. But it was a study of children. It was a population study. I forget the country. It might have been the Netherlands, but don't quote me on that. But it was children rated by their parents. I think they were about 8 years old. And so the parent, based on parent ratings, and they identified whatever percentage in the group was diagnosed with ADHD, but it was a broad population, healthcare population. And so parents rated their children both on the 18 symptoms of ADHD and their sense of quality of life of their child. And it turned out to be a smooth dimensionality. So many children were rated as no symptoms or maybe one symptom, and they had the higher quality of life ratings, again, based on parent ratings. As the parent ratings of symptoms went up, 4, 5, 8, 10, all 18, there was a steady drop in parents' rating of quality of life. So that is the definition of dimensionality. With some medical conditions, there'll be some cliff for blood pressure or some other measure where, once the blood pressure reaches that, or obesity, or whatever the case may be, there's a quantum shift. But this dimensionality, and this is important clinically, one, it's a way to give a non-defensive, you're right, everybody, this is why it seems like everybody has a little ADHD, because the problems are not unfamiliar. We all procrastinate at times. We all forget things. We run late, whatever the case may be. But it's a matter of degree, just like with vision, weight. There are many health matters where it's dimensional, and at some point it becomes problematic, or if you will, diagnosable, or even more so, disordered. So ADHD is one of those conditions, but I think Edmund Burke said it more eloquently than this. It's hard to tell when day turns into night, but it most definitely happens. And I stole that from Ned Hallowell and John Rady in Driven to Distraction. But it's important clinically because there could be subthreshold presentations of ADHD causing many problems. But if somebody's like 1 or 2 symptoms short of the diagnosis, it's not like, oh, no, this isn't diabetes, we don't need to do anything. It's like, well, that could be, and that's unfair because there could be, borderline diabetes. So that's not the best example. But here with ADHD, there might be a situation where somebody goes, you don't have all the symptoms, but there's no better explanation, but that this is consistent with ADHD, but you might just have a subthreshold case.